हेलो एंड वेलकम टू टॉक ब्रेकफास्ट। विवेक और सोबिया आपके साथ है और हमारे साथ आज है डॉक्टर उषा किरण, द हेड ऑफ डिपार्टमेंट एंड कंसल्टेंट गायनेकोलॉजिस्ट स्पेशलाइजिंग इन मिनिमल एक्सेस सर्जरी एंड वी नोट स्कारलेस सर्जरी एंड हाई रिस्क ऑब्स्टेट्रिक्स प्राइम हॉस्पिटल से। डॉक्टर उषा, वेलकम टू टॉक ब्रेकफास्ट। और आज वी अज्यूम दैट यू हैव समथिंग वेरी इंटरेस्टिंग टू शेयर विद अस।
Yes, Vicky, thank you very much for inviting me to share this news with your audience, which is a very unique news. We have introduced here in Prime at the moment a new surgical technique, a Scarless hysterectomy technique. And I'm proud to say that we are the first people to introduce this technique in the UAE.
Absolutely amazing. Congratulations on this. And want to know what is hysterectomy? If you could tell us more about it.
Yeah, hysterectomy is basically removal of the uterus, and it is done for women with certain problems. And I would say the problems would be somebody who's having excessive bleeding, which is not controlled by medications, or sometimes you have uterine tumors like fibroids, endometriosis, or sometimes weakness of the support of the uterus giving rise to uterus dropping down as prolapse. So there are many more reasons for women requiring a hysterectomy. But yeah, this is offered only for women who have finished their childbearing or who do not wish to have any future children, because otherwise there are other methods of treating this condition.
And is this a major surgery?
Yes, it is a major surgery because we are removing one organ as a whole, like the whole uterus is removed.
All right. And what are the side effects with this?
Now, there are risks involved in the surgery like any other surgery, whether it's a general surgery or gynecological surgery. There could be bleeding, infection, injury to surrounding structures, etc. But side effects as such, they're not risks really. We're talking about once the uterus is removed, what are the problems that women might have in their life. Now, uterus has only a childbearing function and a menstrual function. So, once she has hysterectomy, she cannot have any periods in future, and she will not have any children in future. Apart from that, it should not have any side effects on the general well-being, because that is to do with the ovaries, not with the uterus.
And what are the different techniques? Now, you have a technique जो आपने master किया है, and it's a 120-year-old ancient science, if I'm not wrong, right?
Oh, yes. So hysterectomy per se is it's been done since 17th century. So it's really a very old technique. But over the years, surgeons have tried, to develop new techniques for the betterment of the patient and patient care. So it evolved over the years. Originally, we would do it with a very big, ugly vertical cut, like up and down incision. For some cases, we still do them like in cancers even now. But later on, in 1920s, we got to start doing them through a bikini line cut, which was less painful, cosmetically much better in terms of scarring. And the major breakthrough came in 1988 when laparoscopic hysterectomy was introduced, which was like through the telescope with only 4 small cuts. Now, that is at the moment, the laparoscopic hysterectomy is the one which is being done all over the world and also here in UAE as a routine. So that gives a better recovery, less scar, 4 small scars, less pain. So that is the one which we are following at the moment. Then in the last few years, there came with something called a single incision, the cell laparoscopic surgery, which was like one small cut in the belly button. So it was almost scarless, not exactly scarless. However, what has happened with this new technique that I'm talking about this is introduced in 2017, not in the UAE, outside the UAE, in the Europe, and this is totally scarless. There is not even a single scar, not even in the belly button.
So how do you do this with magic?
No, not really magic. It appears like magic, but no, not really magic.
But
no, it is called VNOTES Hysterectomy. So it's called the natural orifice transluminal endoscopic surgery. I know it sounds very complicated.
Right. So what's the short form again?
Notes, N-O-T-E-S.
Right. The V notes, as we mentioned earlier in the call?
Yeah, for the gynecology, it is the V notes. And for the general surgery, it is just notes surgery.
And how did you master it? How did you come across it?
Well, what happened was that last year I had this patient who came to me, and she said she had this huge, large fibroid, and she told me, I want to have this hysterectomy done, but I want you to do it without any scar.
Mm-hmm.
Now, for smaller uteruses and certain conditions, like prolapse, we can still do it from below without any scar, but for not these big uteruses.
Mm.
So I said to her, sorry, dear, it's not possible in your case. It's more complicated.
Mm-hmm.
And she said she was a little offended, and she tells me, outside of Dubai, in States and Europe, this is possible. Why not here?
Mm-hmm.
I mean, fair enough. But I told her that, yes, this was a new technique introduced in Europe in 2017, but I'm sorry I can't offer you that because I'm not trained for it.
Okay.
So I did not do that surgery for her. She went out and she had the surgery, but she was very nice to come back to me. She said, you were very frank with me, so I want to tell you how good this is, doctor. I have no scar and my recovery was fantastic. And honestly, you're a good surgeon. You should actually do this for people in Dubai.
Mm-hmm.
So that's where my journey for training VNOTES surgery started. I connected with the International Notes Society, and there was a rigorous training. Last year I trained with a theory module, the hands-on workshop, and they scrutinize you. Then you have to send them the videos of your surgery, and then eventually they certify you. So
Awesome.
I got certified, and I'm very pleased to say we're offering this Scarless hysterectomy to the patients in Dubai Prime Hospital. And to my knowledge, we are the first and the only ones who are offering this technique.
Absolutely amazing. Really proud of you. Your, developments, the way you have learnt it as well. And how many of these surgeries have you performed so far, the notes?
So for approximately, I think 20, I haven't kept the count of the last week, but around 20 we have done now.
Awesome. And as you mentioned, there's no one in Dubai who can do it. So a scarless note surgery, right?
Yes.
So how do people contact you, Dr. Usha?
Yeah. Before that, I just want to say, Vicky, that the advantage of the surgery for the patient is that the recovery is much more quicker because there is no scar at all on the abdomen, which means they can move around, mobilize quicker. And pain is really considerably less as compared to the laparoscopic surgery. And also, cosmetically, it is fantastic. No scar on the tummy.
Absolutely amazing. And we're really, I can't be thankful enough that we have Dr. Usha Kiran here in Dubai who can perform this scar-less surgery and absolutely no scar. It is really a revolution, I think, in the medical industry. So thank you so much for bringing and learning and training all of this here and practicing here in UAE.
Thank you, Vicky. I would like to say that patients who are looking at the Scarless surgery can contact Prime Hospital, Garud, on 0429297777. That's the number. Or they can actually contact my nurse on 05634403335.
Superb, Dr. Usha. Thank you so much and such a pleasure to talk to you.
Thank you very much.